Okay, ready to get started? I mean, I look terrible, but whatever. Okay, thank you all for joining us. It's wonderful to see your smiling faces. We're here to, again, try to communicate to the community from your perspective exactly what's happening right now with coronavirus, including the public health response, the economic recovery and business response, and the totally blanking on it, and that's why this is fun to be live. And if you can provide details to your community on the executive order as you understand it, so that people in your community can understand it better. And then I will talk a little bit about public health response and mental health at the end. So by the order, is everybody ready? And thank you to Mayor Wojtowski for getting us set up. Representative Gomberg, what can you tell your constituents?
Well, thanks so much for the opportunity to be with you this afternoon. I'll remind you quickly that I represent House District 10, which stretches along the Central Oregon coast from Tillamook to Yachats, but also swings inland as far as Falls City, Polk County, Grand Ronde, and Sheridan. So I do have a portion of Yamhill County. I will tell you, I mean, the executive order's out, and I'll let people that follow me go into a little more detail, but essentially it defines essential businesses and non-essential businesses and asks that the non-essential businesses close down. And for those people that are operating essential businesses, they are asked to maintain certain workplace standards, in particular social distancing of 6 feet and opportunities for personal hygiene. And there is, in fact, a place where employees who feel those standards are not being met can place reports. I don't want to dwell on that, but I want to share with you a couple of other developments and observations. You will know that the governor made a statement late last week saying, please stay home and stay safe. I had actually spoken to her last Wednesday, expressing the concern for many of our coastal communities that we were seeing people continuing to come, and with good weather forecast for the weekend, we were afraid we were going to get a lot more. The fact is that the coast really just had a major influx of people last weekend, and I would imagine a lot of them were driving through your communities to get there. As a response to that, what we saw is coastal cities and coastal counties stepping up and implementing their own orders to close down lodging. They closed down hotels, they closed down public campgrounds, and they closed down vacation rentals. And the exception that they provided to that was for people who I would describe as residential guests rather than as recreational guests. If you're going to stay more than 30 days, then you can continue to camp, you can continue to stay in a hotel. We wanted to make sure that we had residential opportunities for people that didn't have other housing options, and we also wanted to make sure we had emergency housing for people that may need it. You are now seeing those rules implemented from Clatsop County all the way through Lincoln County, and they are in place right now. The Legislative Joint Committee is meeting as we speak, and they are developing proposals for what will likely be a special session next week. The special session has not yet been announced, and the content of that special session has not been announced either. But, and I'm sorry that Senator Boquist couldn't join us because he actually serves on that committee and might be in a better position to tell you the most recent developments. But we're expecting to see proposals come forward, and we are anticipating that we'll be in special session next week. You know the numbers as well as I do. We are fortunate that we don't yet see a lot of confirmed cases. Lincoln County just got there first. That was interesting because it was somebody who was outside the county at the time that they were diagnosed, and they are being sheltered, hospitalized outside the county, although they may have some family members that were exposed that are in quarantine right now. Nothing yet in Tillamook County. I've seen some numbers for Yamhill County. I couldn't tell you exactly where they are, but so far it's been well, let's just say that we're ahead of the curve. and that if we can continue to practice responsible social distancing and encourage people to follow prudent behavior, I think that we will be able to forestall this thing hitting us with the kind of hammer that it has potential to. That's a real quick overview of where we're at, the local developments as well as the statewide developments. I'm trying to work with people and provide as much information as I can. I think that there's a flood of information out there, some of it good, some of it perhaps not so good. And we've got two classes of people out there. We've got people that are getting overwhelmed with information, and we've got another group of people that really aren't yet getting good information on what they should be doing and how they should behave. And I think that's the great challenge that we're facing today. But as community leaders, I would encourage you to look over the horizon a little bit and think about what our challenges are going to be next week. And I think that at the end of the day, people are looking for calm, steady leadership and good local information. And in the coming weeks, rather than the new state orders coming into place, we're going to be looking at more personalized concerns. We're going to be looking at mental health. We're going to be looking at domestic violence. We're going to be looking at public safety on the downside. On the upside, we're going to be looking at how to communicate to people how they can be more supportive of their neighbors, how they can volunteer virtually, how they can support neighbors that aren't able to go shopping or may have other kinds of particular needs. And we need to provide them with a venue to exercise those good and positive intentions. And that, I think, will help offset the potential negative consequences. So I'd be happy to answer any questions for you real quickly, and then at quarter after, I'm due on a gubernatorial briefing.
Thank you, Representative Gomberg. Do we have any questions from the panelists for the representative before he gets out? Okay, let's go to Gioia to make sure she gets onto her phone call. Thank you so much, Representative.
Thank you all. Thanks for your good work.
Yes.
Thank you. Thank you, Representative.
So this is
Good afternoon, everybody.
Go ahead.
Yes, it's Gioia. Hi. Thanks for inviting me to be on this call, Commissioner Kula. I appreciate it. Shannon and I are working very closely with Abisha and our Oregon State Chamber colleagues and countless other groups of people. We're on phone calls all day long and trying to get as much information as we possibly can that we can share with our communities. I thought the representative's comment about communication and people getting timely information was so spot on. So my little portion of what I'm going to tell you about is a little bit about, I was on a call today with the with the U.S. Chamber. There was a conversation that we had about the CETA guidance on the essential critical infrastructure workforce. So I've included that document in an email that I just sent to all of you. You can read through that, but it basically tells you really, if we were to be in a lockdown in the state of Oregon, that's what we would have to follow. And we also talked a little bit about cybersecurity, how we probably are under a risk. I mean, we're always under risk for some kind of a cyber attack. But, you know, now that things are in, you know, we're in the situation we're in, this is something we all need to be aware of. So to certainly have as much security on your computers as you possibly can, particularly if you're working at home. The Oregon State Police also sent out an enforcement fact sheet that I've included in that email to you. I recommend you read that. It basically says you're not going to get arrested if you're not, you know, if you're driving down the highway. Well, of course, unless you're breaking the law. But the law is not right now. It does not include you have to stay in your home. If you need to go to work and, you know, your workplace is following those guidelines of 6 feet distance, then you're probably okay. But that OSP document explains that. Shannon's going to talk about the Disaster Loan Assistance Program, but I did include a worksheet in this email to you. And the last piece that I have is the resources for business and employers and workers. And that is from the Oregon Employment Department. And that gives you some information too on the resources that are available to the businesses and also to employees. And I was also included in my email a link to the Oregon Workshare page. So for businesses that need some help with maybe doing work share instead of putting people entirely 100% on unemployment. It will help pay a portion of unemployment so they can maybe work 4 days and get unemployment for 1 day. So those resources are there as well. And lastly, both of our chambers have set up a COVID-19 resource page where we have lots of information for our members and for the community. Anybody is welcome to this. We are helping all of our chamber members plus any community business or phone call that we get. All the calls to the chamber are coming to my cell phone. And we've also both set up restaurant pages where locals can find places to visit for takeout meals. I'm done. I tried to do that in 2 minutes.
You were so great.
Funnel.
Thank you, Gioia.
Thank you.
Executive
You're
Director,
welcome.
CEO of McMinnville Chamber.
Yes, sir. Thank you so much for inviting me to be in this call.
Thank you very much, Gioia. Stacy, do you need to get to your call too?
My call's not until 4 o'clock. My next
Okay,
call.
fantastic.
All good.
Abisha, how are you? I don't actually know how to unmute you.
I'm good on time. Casey.
Okay. Okay, great. So let's go with Shannon Buckmaster, Executive Director of the Chehalis Valley Chamber of Commerce.
Thank you. And honestly, it's a privilege to be in such close working collaborative relationships with so many people throughout our region, throughout our state. It's really an honor, and I appreciate Gioia collaborating with me. So we kind of did a divide and conquer approach here so that you can hear from us. And both of our chambers really are here to support business. We're here to support community and economic development. So it's really an honor to work in this capacity on behalf of our communities. So I'm sure I'm going to overlap a little bit with Stacy, certainly with Abisha, but first of all, some good news coming out from the business community. We did get some details for the federal third emergency aid package. They were released this morning. They include $1,200 per adult and $500 per child to most Americans, a $350 billion package for fully forgivable loans to small businesses. I'll have more information in just a second. $150 billion to support a surge in the healthcare system, boosted unemployment benefits by another $2,400 per month, expansion of unemployment benefits to gig workers, self-employed, and contractors, which was a huge gap in our service to our regional professionals. Also, $150 billion to stabilize state, local, and tribal governments. So within those two, we have two federal support wraparound services that are coming through. We have the SBA Economic Injury Disaster Loan, EIDL. The basic terms of that, and Gioia sent out the details. This is a direct loan from the Department of Treasury through the SBA, the Small Business Administration. Eligible applicants include small businesses, nonprofits, owners of rental property. The purpose is to provide working capital for a temporary loss of revenue. There's no cost to apply. You can apply online. There are links on our chamber websites. There are other links out there. There's no obligation to accept the loan once you're approved. Ineligible applicants include agricultural enterprises, religious organizations, and gambling concerns. Total loan amount up to $2 million, interest rate 3.75% for small businesses, 2.75% for nonprofits. Amortization rates are up to 30 years, determined case by case. Criteria: acceptable personal credit history, demonstrate ability to pay. The use of funds can be for fixed debts, payroll, accounts payable, bills, not to supplement lost income or lost sales or for business expansion. Collateral is required for loans that exceed $25,000. Applicants will not be sorry, I'm getting some feedback. Applicants will not be declined solely on the basis of lack of collateral. However, the SBA will require whatever collateral is available, which may include a lien on real estate. There are several forms. Most businesses are in a good place. However, our chambers are willing to assist with that, as well as the SBDC, the Small Business Development Center, through PCC or Chemeketa, depending on your region throughout the county. This is supplemented by the newly issued this morning line of credit program, which is that $350 billion package. It's compatible with the EIDL. It covers payroll costs, costs related to healthcare benefits, insurance premiums, employee salaries, commissions, and compensations, interest payments on mortgages. Funding does not go toward the principal, rent, or principal, rent, utilities, interest on outstanding debt obligations that could be incurred or were incurred before the COVID outbreak, which began February 15th, 2020. And another note, employers with tipped employees may receive reimbursement for additional wages paid to those employees during the outbreak. Limitations, payroll cap at $100,000 per employee cannot be used to cover paid or sick leave, as credits have been provided in the Families First Coronavirus Response Act. Maximum amount of loan is $10 million. Small businesses can receive these forgivable loans up to 125% of payroll to address important payroll and operation costs. The administration has guaranteed these loans, so no personal guarantee or collateral is required for these loans. The line of credit may be forgiven if businesses return to pre-COVID-19 workforce levels by June of 2020. And if a business applies for the SBA EIDL loan, that first loan, by March 31st, the information and forms from this application can be electronically transferred to the line of credit loan. Otherwise, the other updates for our frontline response nonprofits, the Oregon Community Foundation and Ford Family Foundation both have funding available, information on their websites. OCF is has launched a new grant for nonprofits impacted by COVID-19, and the Ford Family Foundation is specifically looking for projects that connects kids with food. And then finally, as part of Governor Brown's executive order, childcare providers have been ordered to close unless they are providing emergency childcare. Childcare providers are allowed to remain open if they're providing emergency childcare. The executive order was set for today, Wednesday, March 25th. The deadline, that was the deadline set for providers to either close or transition to emergency care. The provider application is available online and must be submitted by Friday, March 27th. Parents who are in need of emergency childcare can call 211 and get in that referral system. The executive order asks providers to prioritize first responders, emergency workers, healthcare workers, essential personnel. Many providers are already doing this or in serving families. They can continue to do so. These include not only healthcare professionals, but those who work in places such as grocery stores, warehouses, homeless shelters, agriculture, etc. And the executive order does not apply to those who care for 3 or fewer children. There you have it.
Whew. Thank you very much, Shannon Buckmaster. Abisha, do you have way to end it?
You bet. First of all, I want to kind of reciprocate the appreciation and say thank you to both Shannon at the Chehalis Valley Chamber and Gioia at the McMinnville Chamber for being such great partners. So for those of you that I don't know, my name is Abisha Stone, and I'm the Economic Development Manager for Yamhill County through SEDCOR. SEDCOR is a Strategic Economic Development Corporation. We cover Marion, Polk, and Yamhill counties as the Economic Development Service Provider. And I am so grateful to be working with these very, very capable gals. And also, they make my job so much easier because Shannon already covered all of that other stuff, so I can just talk about a few other items here. So as the Chamber's focus mainly on kind of our retail and commercial partners and our more local partners, SEDCOR focuses mainly on traded sector. Obviously, there's some crossover and we have some shared members. So in the traded sector realm, I want to give you a few updates. What we're really seeing, of course, most immediately was impact to restaurants, bars, direct service companies, businesses on Main Street, that sort of thing. Our traded sector companies have mostly been working on trying to understand these new regulations that have been rolling out, as you're all certainly aware. Many of them are identified as critical infrastructure industries. So imagine the food industry, wood forest products industry, pallets have been identified as such. So we're fielding a lot of questions about how do they make sure that they are on that designation list? What are resources available to them? How do they protect their employees? There is a big demand for translating all of these new rules into HR policy, which of course, as some of my counterparts say, we're learning to build, we're building the plane as we're flying it, right? So there's a lot of that work going on. We also see a lot of who are currently considered non-essential businesses, manufacturers, trying to make a conversion to be an immediate service provider of essential materials for the relief efforts. So for example, if we have a company that is a metals manufacturer who is not considered essential. They're looking to see if they might be able to make respirators to serve an immediate need in the emergency system. We're also seeing a lot of our large manufacturers donating supplies to the emergency medical relief programs, and there has been a lot of outreach and sharing of resources. There are links that are set up. We also have a COVID-19 page now on the SEDCOR website where we have attached these links that businesses can go into and basically put themselves on a list of as a potential provider, answer a short survey, and then be connected to maybe material resources or any other supply chain partners to become a potential provider. In addition, we provide support by way of policy recommendation and program recommendation to the Board of Commissioners. I recently submitted a recommendation for consideration regarding an immediate relief grant program and a more forward-looking loan program, the details of which will be reviewed by the Board of Commissioners tomorrow, and if accepted, of course, made public. What we're looking to do here, and it's a changing environment, so new information is coming every hour, every moment, but what we're hoping to achieve is to, again, bridge, right? To be a bridge where there's not currently a resource and there's a significant need. And so that's what we're really focusing on. We're also looking to take a regional approach to some of this work. So we have been partnering, as I said, SEDCOR covers Marion, Polk, and Yamhill counties, and we have been partnering with economic development practitioners and other partners, agencies in the region to try to identify if there's a regional approach to some of these lending programs and other such support mechanisms so that we're not recreating the wheel and that we're all leveraging the support with each other. As we all know, we have, fluid borders and many of our community members work outside of the county that we're in. We want to make sure that we're holding each other up to the best of our abilities. SEDCOR is also serving as the central communication coordinator for the governor's core team for our region. So if you have any additional needs or requests or information that you'd like us to post and share, please let us know. We recently issued a survey which was actually requested by the governor and the regional solutions team. And with the help of both of the chambers in Yamhill County, we were able to build a very thorough understanding of what the need currently is in our county. We received an abundant amount of responses through that survey. And so I just want to once again extend my deepest gratitude to those two chambers for being such frontline service members and engaging their businesses. And that's all I have, Commissioner.
Thank you very much, and thank you to all of the economic development and business leaders here. I really appreciate all the work you've been doing on this. So we're going to need you at like your full-on game for the next year ahead at least. So thank you very much. We're going to go to Stacy from Senator Merkley's office, and then we'll go to Sheriff. So Stacy, what can you share with us?
Well, Shannon did a really awesome job. She did a great job sharing some of the top lines from the bill. But so where we're at right now is the Senate came to an agreement with the White House last night on what the Senate can put out. So we have a 400-page text that we as staff and the senator are digging through, trying to get details. And as every answer we get spurs more questions. So as you have questions about what are in these bills, please feel free to send those to me and we'll try to get them answered, but just know that we are also trying to figure out the answers as we go. So like I said, Shannon did a really great job saying some of the top line things, and a few things I'll add that are in there. There's $20 billion going to the VA to help them serve veterans. $50 billion for Department of Ag. That's going to include additional assistance for food banks, SNAP funding, and a number of other programs. $1 billion for CSBG, $750 million to Head Starts for emergency staffing needs, $170 billion going into the healthcare system. So that's going to be, that's hospitals, that's staffing, that's CDC, that's National Institutes of Health, and we're working on getting details for all of that for folks that are interested. $5 billion for CDBG for communities to respond to the COVID outbreak, and then $25 billion for transit systems to keep their riders and their employees safe. There's a lot in this bill, and we are, like I said, trying to work really hard and fast to get clarity. There's been a lot of concern about small city stabilization funds and the way that they're being allocated, and we're trying to get to, I'm not sure if y'all have heard of that, but we're trying to get to the bottom of why it looks like small cities are left out of that equation, and just wanted to let you know that the senator is aware of this situation, has been talking to local leaders and trying to figure out a way through to make sure that small communities do get that money that's there. There's about $150 billion for that local community, state, tribal, and community stabilization. But the way that it's allocated has folks concerned. So we are looking into that and are trying to get answers. And again, I know I have more questions than answers right now, but that's where we're at.
Well, thank you, Stacy. If we have time, perhaps we can ask some questions later.
Yeah, and I'm happy to take those. If I can't answer them right now, I will figure it out.
Great. And I've got one with you that you're working on, so I appreciate that. And there's a lot of people who are wondering about that in the community. So
yes, 100%.
Thank you very much.
Thanks,
Sheriff. Oh, first, before going to the sheriff, I just want to acknowledge that Superintendent Morelock from the Newberg School District has joined us too. So thank you, Superintendent. And we're going to go sheriff, and then Counselor Sandoval Perez, Miriam, and then we'll go to superintendent. So.
Casey, can I say one more thing that I forgot? Another thing that we're hearing from all communities are Oregonians stranded overseas. So I know a lot of local offices are hearing about that, and our office is helping right now probably about 100 to 150 people who are stranded overseas. And so send those our way. We have dedicated constituent services staff who are literally working around the clock trying to make sure that these folks are getting home. So just email me, name, phone number, whatever you know, what the country they're in, and how I can get in touch with them, and we'll reach out and try to see what we can do.
Great, thank you very much. Sheriff, what would you like to say to folks? And thank you for joining us.
Oh yeah, anytime. No, I appreciate it. So just a little bit about the law enforcement response. As everyone has said, and Gioia did a really good job of outlining what the OSP fact sheet. We actually posted that on our Facebook page as well. Ultimately, law enforcement's intent through this entire piece is going to be educating the general public on what it is that we need to be doing and what we're not going to be doing. And for the most part, the goal is to get people through education to comply with these orders and just continue to push out the same message that these whole social distancing measures, the not congregating in a public place in large groups, all those are ultimately designed for one thing, and that's to slow the spread of the disease. Right now, currently, I'm serving as one of the 3 OSSA representatives on the state COVID-19 strategy team. We are working directly with the Oregon Emergency Management and OSP through the ECC on coming up with protocols, strategies, and ultimately tracking all the resources across the state for law enforcement response, any resource needs that they may have for PPE, and putting them all together so that if there's any issues that need to be addressed statewide, we're able to do that. Also, from local perspective, some people may know, we've been working really heavily with the courts and the district attorney's office and our community justice to come up with new protocols on people that are going to be coming into our facility. Obviously, with our jail population, there's a huge concern of an individual being brought into the facility that could possibly be infected, and addressing and affecting the rest of the jail population. So we have, in essence, through a lot of different types of work with the courts, have reduced our jail population. I think this morning showed that we had a population of 80 people in our facility. We traditionally run about 195. We have changed the custody process, the type of crimes that we'll actually bring people in for. We have a whole process for scanning and inspecting individuals prior to coming into our facility to make sure they're not showing any signs. So we're doing a lot of proactive work to try to keep not only our staff safe, but the individuals that are still in our facility safe from this. But as we continue to move forward, our staff is committed to doing everything they can to basically just keep the peace. I gave a small little video message to my staff this morning that basically outlined my expectations for them. And it's not that often in law enforcement where you'll have a department head or the sheriff telling their staff it's okay to just drive around and be present and not be proactive. It's okay for you to be driving around and waving at people and not stopping every car that you see drive by for a violation, because we're trying to do everything we can to be part of the solution and assist with the social distancing.
Yeah. Well, thank you very much, Sheriff. I know I've read some of your releases, and I'm very impressed with all the dedication that you've put into it and the time and the thought. So I really back you up and support you in this effort. Thank you.
Thank you.
I feel like your patrol deputies seem more friendly than ever when I see them out on the road. So
very nice.
Yeah. So thank you, Councilor Sandoval. Perez, would you be able to speak? Are you ready to speak to your community, and what would you like to tell them? And I think that you need to unmute yourself.
I unmuted you. You're good.
Okay.
So thank you very much for the opportunity to address our Spanish-speaking community on this very important topic. I really appreciate that. So I will be addressing the Spanish-speaking community, so my message will be in Spanish. Quiero darles primeramente la bienvenida y gracias a los miembros de la comunidad que están aquí. Quiero informarles acerca de la orden ejecutiva que la gobernadora emitió el lunes. Esta orden de manténgase en casa, salve vidas, es un llamado a todos los miembros de la comunidad de ser más agresivos en nuestros intentos por mantener el distanciamiento social para tratar de evitar que el coronavirus se siga extendiendo. Esta orden cierra muchos negocios donde fuera imposible mantener el distanciamiento social, pero hay algunas excepciones. Por ejemplo, tiendas de comida, bancos, farmacias, gasolineras, restaurantes con comida para llevar o con entrega a domicilio, entre algunos otros. Parques y áreas de juego están cerradas, al igual que centros comerciales, salones de belleza, gimnasios, museos y otros centros de recreación. Básicamente, la orden dice no salga a lugares públicos, al menos que sea absolutamente necesario. Cuando esté fuera de casa, evite contacto con otras personas y manténgase a por lo menos 6 pies de distancia de personas que no viven con usted. Recuerde que especialmente las personas jóvenes que no están demostrando síntomas pudieran estar extendiendo el virus sin darse cuenta. Por eso es tan importante que todos sigamos esta orden para protegernos no solo a nosotros mismos y a nuestras familias, sino a los demás también. Y esta orden está en pie hasta nuevo aviso. Durante estos momentos es muy importante mantener su salud física, pero también su salud mental y emocional. Por favor, haga videollamadas con sus seres queridos, juegue con sus hijos, salgan al jardín. Si asiste a servicios religiosos, vea los servicios en YouTube o Facebook que muchas iglesias están ofreciendo. Cocinen, vean películas, pero sobre todo hablen con los miembros de su familia para saber cómo se sienten los demás y reconocer si alguien necesita ayuda durante estos momentos en que la vida cotidiana se ha vuelto tan diferente. Este no es un momento para estar aislados y no es un momento de pánico, pero sí de precauciones. Y recuerde que esto no va a durar para siempre. Si todos ponemos de nuestra parte, saldremos adelante más pronto. Y si usted necesita cualquier tipo de ayuda durante este tiempo difícil, lo animo a llamar al 211 para obtener información de recursos disponibles en la comunidad para ayudarle de distintas maneras. Tienen recursos en amplios temas, así que si usted necesita ayuda, llame al 211 y ellos lo pueden conectar. Aunque no podemos estar físicamente juntos, podemos y debemos mantenernos unidos. Gracias a todos los que continúan cuidándose y ayudándose los unos a los otros, lo cual es más importante ahora más que nunca. Recuerde, unidos como comunidad, mantengámonos en casa y salvemos vidas. Gracias.
Thank you very much, Counselor. It was wonderful to have you join us. I really appreciate it. And I know how to get a hold of you now. Miriam, are you ready? Okay, thank you very much for joining us, Miriam. And can you introduce yourself?
Yeah, thank you for the invitation to be part of this call. My name is Miriam Vargas Corona. I'm the Executive Director at Unidos Virgin Community, and I'm also going to be sharing my comments in Spanish. Buenas tardes, mi nombre es Miriam Vargas Corona, soy la directora ejecutiva en la organización Unidos Virgin Community, y yo también voy a estar compartiendo una información para nuestra comunidad hispanohablante. Tantito del trabajo que hemos estado haciendo en Unidos. Ahorita estamos haciendo abogacía con la legislatura estatal para asegurar que esta nueva el trabajo que se está haciendo con el Comité Especial de Coronavirus tenga fondos disponibles para ayudar a personas que no son elegibles para los beneficios de desempleo. Queremos que sean disponibles para todos, sin importar el estatus migratorio. Entonces, si hay personas que gustan ayudarnos en esta abogacía, haciendo contacto a sus representantes de la legislatura estatal, nos pueden llamar para darles instrucciones de cómo hacer eso. También estamos trabajando con el Departamento de Salud del Condado de Yamhill para asegurar que todo lo que está publicando a la comunidad esté en español y sea basada en preguntas que estamos recibiendo de la comunidad. También hemos ofrecido nuestra ayuda para traducir avisos y documentos importantes. Hemos estado ofreciendo esta ayuda a ciudades y organizaciones comunitarias para asegurar que toda la información que se está divulgando a la comunidad esté en español también. Quiero asegurar que nuestra comunidad sepa que si no encuentran respuestas para preguntas de diferentes programas de ayuda financiera, ayuda para comida o diferentes servicios de ayuda, por favor comuníquense con Unidos, ya sea por nuestra página de Facebook. Nos pueden llamar o mandar un texto y nosotros podemos ayudar a buscar respuestas para sus preguntas. Y al final voy a dar el número de teléfono. Una de las preocupaciones que estamos escuchando más es sobre las protecciones a los trabajadores. Ya que hay nuevas reglas del distanciamiento social, sabemos que muchas personas están preocupados de su seguridad y de su salud cuando están yendo a los campos o diferentes lugares de trabajo. Entonces, queremos que sepan los trabajadores que si ustedes piensan que tal vez sus patrones o la compañía donde están trabajando están violando sus derechos como trabajadores o están violando esta nueva orden de la gobernadora, hay una organización, el Centro de Ayuda Legal de Oregon, tiene abogados que pueden ayudar a poner una queja. Estas quejas son a la Administración de Salud y Seguridad para asegurar que los lugares de empleo estén ofreciendo protecciones de salud y seguridad a los trabajos. Entonces, hay esa ayuda disponible. Igual, Unidos está aquí para compartir esta información, poder encontrar respuestas a sus preguntas. Y nuestro número de teléfono al que puede llamar o mandarnos texto es 971-261-0817. 971-261-0817. Y de nuevo es Unidos Virgin Community. Mi nombre es Miriam y aquí estamos para servirles, para ayudar a encontrar respuestas a sus preguntas. Gracias.
Thank you very much, Miriam. It was wonderful to have you on. And Miriam is really, I feel like, in a way, a force behind getting more things translated into Spanish, both at the county and the cities. So I really appreciate that. I've come to realize that how important it is for us to have things in the languages that people speak in our community. So thank you. Superintendent Rec, are you ready to speak to your community? And thank you for joining us.
Opportunity to meet everyone and be part of the conversation. Thank you for unmuting me. as we go. As a school system, we closed schools starting on the 16th following the governor's directive. We did close schools on that Friday before, which allowed us to prepare and plan to deliver meals, which we did our first week of school. So we set up a system of using our buses and delivering meals out into the community every day the week before spring break, and it was very successful. We ended up reaching about 3/4 of our student population that first week with meals, breakfast and lunch. We also used that first week really to start beginning a distance learning plan with our secondary students. We set up a time right before the school closure that set up staggered time that students could come get their materials and computers to start working from home. So we really used that first week to start that process of distance learning for our secondary students. And we also gathered instructional packets for our elementary children. So we think we have a pretty good start. When we return after spring break, we'll advance what we're doing and look for the glitches and what's not working. But I think at least this first closure opportunity from the schools, at least today, we had a pretty good handle on delivering meals and still creating instructional opportunities for children.
Well, thank you very much, Superintendent.
Thank you.
Just like Mary Alice Russell from the McMinnville School District,
Yes.
I want to thank you for moving so quickly and being so creative.
Well, thank you.
Yeah, and it made me happy to see the school bus go by dropping off food for people. So
Yes.
thanks.
It's very needed, needed in this difficult time. Thank you.
Yeah. Superintendent Morelock, thank you for joining us and thank you for your patience. What would you like to say to your community and to your school district?
Well, Commissioner, thanks for the opportunity to address everyone. And like my colleague to just the south of us, we have also been out serving meals. We got that spun up day one of the break, and we've extended that, of course, into spring break. We do have multiple sites we've added, and I actually wanted to go through those sites very quickly because I want to make sure that everybody's able to get the meals necessary. And so it's been important for everyone to get out. We do have breakfast at Edwards Elementary from 8 until 9 in the morning. And then we serve lunch from 11 to noon at Edwards Elementary, at the Aquatic Center, at the Newberg Public Library, and Dundee Elementary. And then at a place called Deskin Commons, we serve lunch from 11 to 11:30. También quería hacerlo en español para los que están aquí tal vez escuchando todo, que tenemos desayuno en el Edwards Elementary desde las 8 de la mañana hasta las 9, y también Edwards Elementary School en la piscina pública, en la biblioteca pública, y también la escuela Dundee de las 11 de la mañana hasta el mediodía, y en el Deskin Commons desde las 11 de la mañana hasta las 11:30. Todos los hijos, todos los alumnos desde el primer año, de 1 año de edad hasta el 18. So everybody from 1 until 18 years of age is eligible for those meals at those locations. We too are using our school buses to get them further out, and then we will push out further as we find more needs. We've also been attempting to work to find out who needs devices for connectivity. We are building some supplementary learning materials, and that's taken a bit of time to get up and running, and we hope to have those ready to go for students next week, starting on the 2nd. So we have teachers coming together starting early next week to build those resources for learning. If you do need connection or a device, we have sent out some information, and you're also welcome to call the district office here at 503-554-5000, and we can get you some kind of connectivity and or device. Si ustedes necesitan un dispositivo o una conexión a internet, por favor llame al 503-554-5000. So we can help you with that. Y podemos ayudarles a todos para tener una conexión. So it's really important for us to make sure that we're connecting with each kid, that we find the resources necessary. We're planning on also partnering with the Red Cross to do a blood drive at Newberg High School, hopefully next week on Monday. Some more information will come out on that. We appreciate all of our partners in the community and at the county level for helping make all this work. This is quite an upending of an entire system. And so everybody I know on this call and out there in the community who's been helpful for us, we do really appreciate it. So stay safe, cover your cough, wash your hands, and then be looking forward to those materials coming home so parents and caregivers can work with students for the next several weeks. I think that's all I have for you, Commissioner. Thank you.
Thank you very much, Superintendent. I really appreciate it. And thank you for updating your community. We're going to go to mayors now. And let's begin with Mayor Skyberg from Willamina.
Hello?
You got it. We can hear you, Mayor. Actually, we can't hear you, technically.
Okay, can you hear me now?
We can hear you now.
Yeah? Okay, great. I think I've got it. So anyway, first of all, I don't think anyone has asked this question. Does anyone have a current count on how many confirmed cases of COVID-19 there are in Yamhill County at this time?
Mayor, the last I saw, we were at, oh my gosh, I want to say 6, but there you go.
Casey, it was 6, and that came out as of yesterday.
Okay, I almost said the total for the state and then realized that would be a disastrous mistake. So thank you.
That's just
thank
fine.
you, everybody.
We know
Go ahead.
Yes, we know it's changing as we speak, I'm afraid. I just wanted to tell you, everybody, I am just so proud of our residents. They are complying, with the governor's orders, as we speak. We've got a lovely community here. Our city manager, Kenna West, hit the ground running early on and put in place so many things that have worked for us along with council, the safety practices, to keep our residents and city workers safe. Most of our city hall staff is working remotely at this time. We do have one employee that covers the city hall during business hours to keep people safe and up to date. We have placed information, of course, on the website, for our city, like most of you have done. And we've also published articles and informational websites and phone numbers in our local newspaper. We have a wonderful little newspaper that circulates our tri-county, or tri-city, excuse me, and that would be Sheridan's little paper called The Bulletin. It has a lot of information in there for the folks. It circulates Sheridan, Willamina, and also Grand Ronde. Our schools early on, like most of the schools did, do the send the kids home, and we are also serving our kids meals like most of everyone else, I'm sure. Our restaurants and bars, I have to say, at this particular time are pretty well, what I could say, suffering. In order to survive, they've recreated things, and there are takeout programs, if you will, in each of our restaurants. And I'm just hoping residents will order out if they can. And yes, again, we're complying with everything that we possibly can that the governor has said for us to do. And again, I'm very proud of our residents. And I have to say, there's probably no place I'd rather be than Willamina at this particular time. So, and I do thank you for all your work, everybody that's out there doing what you're doing to keep us safe. So thank you.
Thank you very much, Mayor Skyberg, and stay safe out in the West Valley. Mayor Hill, what would you like to say to your community? You've been speaking a lot, including last night, but tell us more.
Last night we had our first electronic city council lasting about 2 hours. We had a complex land use ordinances that we needed to do, and we were able to accomplish that. That went very well on Zoom. A couple of things that I'd just like to share. Number one is that between myself and part of the counselors and the city, we're having daily contact with one another so that we can address issues in a timely manner. Some of you maybe received an email from the American Red Cross, and I'm just going to read one verse of that. Like hospitals grocery stores, or pharmacies. A blood drive is essential to ensuring the health of the community. The Red Cross will continue to hold blood drives during this challenging time, and you're encouraged to keep your blood donation appointments or to schedule. And I've seen a number of those happening in McMinnville, heard about a few on the phone today. So again, every time that we can talk to the community, remind them of the need to donate blood. Tomorrow in McMinnville, we have a group that meets together on a monthly basis called Leadership McMinnville, and that's all the CEOs of the large corporations. We have the hospital, we have the schools, the colleges, and nonprofits, and government together. We're going to start meeting weekly on Zoom so that we can share from a city perspective what's happening with the leaders within our community, and then we listen to what their needs are. So we're excited about that, and so that will be happening tomorrow. Received an email from Senator Boquist at the end of last week that shared that the doing what the governor's asked us to do of stay home, stay safe, we are curbing, and he'd indicated that we are in line with South Korea. So staying home, staying safe is really helping us delay some of these the growth of the disease compared to some other states and communities. Like everyone else, our restaurants are closed, but they're coming up with innovative ways of drive-throughs, drive-ups, delivery services, and our message is to shop and to eat locally in the right way. Two other things that I'd like to do: McMinnville Water and Light, we have closed their offices down to protect those that are working there. We have made our crews much smaller so that if there's any infection, that it wouldn't spread through McMinnville and Water and Light, because they are an essential service. Water will always be available, and electric, we have sources that are not going to be able to, that will not be contaminated, so we can move forward with that. You know, I like the thought is to, during times of need, to watch out for our neighbors. Last Saturday, I had an opportunity to work in the yard. I was even 6 feet away from my wife as we were pulling weeds, but it was amazing how many individuals in our cul-de-sac stopped, stayed in their cars. We talked to them. I had an opportunity to talk to every neighbor last Saturday as we were working in the yard. And then the last thing that I would have is cyber awareness. Both McMinnville and Mac Water and Light, this is an area that we have been working very hard on over the last year and a half to make sure our systems are safe. And as we have more and more people working from home, we have the VPN, and we have encrypted and safe ways of being able to communicate. And so that would wrap it up for McMinnville.
Great. Thank you very much, Mayor, and thank you for all you're doing in the city and for communicating so well.
Yeah.
Mayor Wojtowski, in addition to hosting this meeting and keeping us all here for it, what would you like to speak to your community about today?
I do have a few things. Some of it will be redundant from our last Zoom meeting. I do want to share a little bit of that, even in recap, in case other local mayors watch this, and I want to let them know what resources they have available to them. So one is that the city of Dayton declared a state of emergency pretty early. We did so preventatively or proactively, so that we could move money if we needed to and respond as quickly as possible. A few cities are still working on that, and I did share that declaration with at least 2 other cities who requested copies. But if there are other cities who want that, I'm happy to share, so that you don't have to reinvent the wheel and redo the work that's already done. That's time better spent on moving forward. The city of Dayton also suspended shutoffs of our utility services and all related fees. That's, of course, just in this time of economic crisis. We certainly don't want somebody unable to buy food or medicine because they had to pay their city water bill. That can wait. Additionally, we did close our city hall to the public, but we're continuing to carry out essential services. So we still have public Works responding to emergencies. We had a minor water leak, for example, on Saturday night. Public Works did respond to that, repaired the leak very promptly. Additionally, we have staff that are taking calls, processing payments on the phone, and answering questions. So we are carrying out business, but with our doors secured so that staff can stay safe and continue to provide those services. Our food pantry is operating really well. They've been, of course, volunteer supported. They packed food boxes this week and distributed twice as many food boxes as they typically have. So there is an increased need that's been noted. Fortunately, because of our state of emergency declaration, we did have funds we were able to free up to help provide shelf-stable proteins in particular, but to help fill those boxes to make sure our community is properly fed. Another support that we just started yesterday is what we're calling the Urban Program. It's the utility rebates for businesses and neighbors. My mama came up with that good name. And what that allows is for residents who are willing to purchase food locally for their $25 of receipts, we're going to reduce their water bill by $15. And that is good for up to 3 credits. So they can have $45 off that water bill. That's almost half off. For buying food downtown they likely could have anyway. We're also doing that based on a calendar month, which means this week families might get to eat really well from their downtown restaurants and cut their water bill in half at the same time. So we're getting a lot of positive feedback on that. So I know Mayor Skyberg, you talked about, your bars and restaurants suffering. Yesterday, our local bar delivered breakfast burritos to my house at a scheduled time. So my kiddos got out of their bath, got dressed, and had breakfast burritos, and they were really excited. So that's an option you can consider too. And I'd really encourage other small communities to try to get programs enabled like that that can help, help your residents support the businesses so it's not all direct grant funding. I know a lot of us have really limited budgets. We all actually have really limited budgets, some more than others, but it's a way of shifting that money around so that helps the people who are most at risk right now. And I do also have another role. Some of you know I also chair the board of directors for YCAP, so I'm going to share a little bit about what YCAP is doing right now. Our shelters are continuing to operate, and that's really critical at this point. We house lots of folks who don't have other permanent placements lined up at this time. We're continuing to move people in and out of apartments as needed, and continuing casework. We have deployed funding also for at-risk homeless who either cannot be in a shelter for medical needs, elderly, things like that. And we're finding alternative placements for that, including hotel vouchers in order to get them housed. We're setting up shelter collaborative check-in calls and looking at ways to change our screening tools and things like that so we can make sure we're helping as many people as possible without putting our frontline staff at increased risk. Our food bank is preparing boxes and we're shifting a little bit. We do really heavy produce boxes. Right now we're shifting to come up with more shelf-stable food options so that depending on what our supply chains look like and what grocery store supply chains look like, we're really giving people food that they can have for a little while, that they can ration if they need to, but it's enough to get people by. And we're also looking at some new delivery options, as well as trying to increase support for some of our satellite partners so we can keep Yamhill County fed.
Thank you very much, Mayor. I appreciate it, especially the update from YCAP. Thank you very much. I just wanted to add a few more things and then we'll open up to questions, and I apologize for this going long. I wanted to remind folks, so I'm Yamhill County Commissioner Casey Kula. One of the things I really want to stress to people in the community is that the reliable sources of information are very, very important. I encourage people to go to the OHA website if they need more information, the Oregon Health Authority, or the Centers for Disease Control and Prevention. I've seen a lot of comments out in the community of, well, my friend who lives in China, or I heard of a professor stuck in Italy, and their advice may be accurate, but it's not public health advice. It's simply an anecdote. So please follow the guidance of public health officials. And to that, the public health official comment, I wanted to stress that public health knows and wants you to know that it's very important in times like this to seek mental health services if at all possible. This can be a time when people get anxious, they get worried, and Yamhill County Mental Health is there for you. So if you go to the Yamhill County homepage, you can find out information by clicking on Health and Human Services on how to get help. And Yamhill County Public Health or Mental Health, Adult Behavioral Health, and Children and Families is a resource that's there for you. So please make use of it. I had a question from one of our attendees in the audience about testing and the availability of testing. And right now, testing supplies are still relatively limited, and individual clinics and hospitals have been given the discretion by the Oregon Health Authority to do the testing the way that they want to do it with the testing supplies they have on hand, essentially. So as you see more positive tests and more cases show up, it's because there are more commercial tests out there. Many of the facilities, clinics, and urgent care and hospitals are actually doing drive-through testing, so the person never comes into the hospital. But if you have questions about it beyond what 211 can help you with, call your primary care doctor or your clinic, or call your urgent care, but don't go in beforehand if you're experiencing the symptoms. There's still a need for donating personal protective equipment. If you have personal protective equipment, masks, gloves, face shields, please bring them to 412 Northeast 4th Street in McMinnville, and that's the Yamhill County Public Health Building. And they can make sure that they get out to the people and the organizations that need them most around the county. I mean, I know that the sheriff's office has a need for them as much as anybody else. So one of the things that's really important these days is to rely upon the government sources of information at the CDC and the OHA, but to also respond to your neighbors who are in need. So check on your friends, check on your family, and make sure that they have what they need, but at a distance. So if you want to do a grocery run for a friend or a neighbor, do that and make sure that you don't make contact with them. Leave the things for them. So be careful and be safe, and please stay home. I tried to help explain the executive order to folks as they bring up questions, and I'll continue to do that on my Facebook page. I'm not the end all be all of that, but I can help you kind of navigate the process. So if people have questions for me, my email is kullac@ceo.yamhill.or.us, and the Facebook page is Commissioner Casey Kulla. So thank you very much. We have some questions from the audience, and now I'd love to open it up to them. One of the questions was from Roxanne about mental health services. And I wonder, does anybody know, would anybody like to take on the accessibility of mental health services? And Roxanne is also commenting that many people don't have regular providers. And that's a really important component of accessing any services, especially if you think that you have the symptoms of coronavirus. Anybody else want to tackle that question? All right. Does anybody, I'm trying to see if there are any other questions here. But does anybody here on the panel have questions for anybody else on the panel? You can raise your finger. How about that? All right. Well, do we have any? It looks like we've got at least one, I think, reporter from a news source who's watching too. Nicole, do you have any questions for people while you got them all here? Nicole says no, thank you. Okay, well, any last comments before we close then? Is there anything you really want to tell somebody? So raise your finger.
Casey, how often do you think we're going to have this meeting?
I would like to do it every couple of days, as long as Mayor Wojtowski doesn't have to always organize it. How about that?
Yeah.
How much would you prefer?
What was the question?
How many times would you prefer, Mayor?
Oh, I'm okay with every couple of days. I mean, obviously things are changing really quickly. I think, I mean, maybe we could try like Tuesdays and Fridays or something. I mean, I think a couple days a week is probably sufficient.
Yes.
Barring something new. I think if we get, a new executive order, for example, I think probably having something same day, next day would be appropriate. Other than that, yeah, I think maybe twice a week for a standing meeting is probably okay. My children are pounding on my door and I hear the dog freaking out. I don't know what's happening in the hallway.
I'm sure it'll be fine. There's a sheriff on the line. Oh yeah. So Kim Hamlin's is back on, and she wants to know: can someone explain why Oregonians aren't being tested? I think more people would stay in place if they knew how widespread this is. Does anybody here want to take it? I'm happy to address it too.
I'm happy to make some comments. I can say I've been on probably a dozen pretty broad calls, just like I know Commissioner Kula has, I know Mayor Hill has, I'm sure several other individuals are on pretty constant conference calls at this point. And the message that the League of Oregon Cities and the Oregon Mayors Association leadership is getting is, I mean, the reason that the testing isn't happening is that test numbers are limited. And so they really have to use discretion in deploying them and choosing who gets them. And unfortunately, right now, what that means is that people aren't very broadly being tested, and people are being tested at the point that they need to report at a hospital. And it's been pretty symptom-based kind of triaging. I think that there's definitely a big hope and a narrative that will shift, and we're waiting to see that on the ground. I think we're hearing from the federal government that lots more tests are coming down. We're hearing from the state government that they're expecting more tests to be distributed. And we're just kind of waiting for all the messaging to connect at this point. But I don't think there's any kind of opposition, certainly not at the local or state level, to testing wider. It's just access to those testing, to the ability to test.
Right.
And Casey, the one thing that I did, I think some of the mayors and some of those on the phone are getting the OHA reports on a daily basis now. And as I looked at yesterday's report, of all those that have been tested, only 5% are coming up with a positive. And so that's a fairly low number. And so I'm guessing that has something to do with it, even though 5% is 5%, but you look at some areas, some states like Washington, California, New York, that have much more than that. That would be one thing that I've heard also.
And that's a really good perspective. Mayor Wojtowski, did you have?
Yeah, well, it looks like another from the audience is asking why we can't get more tests. Can we make our own? And to that, I'll share, I was actually working with a private company for a while on their ability to test. I was hoping to try to have Dayton be a site for drive-through testing. We worked on a facility and kind of a system for that. And we do have some framework in place. They had initially thought they were going to be able to deploy testing and be supportive on that. Unfortunately, their test didn't come through either. As far as Oregon, making their own tests, there are several private companies trying to get access to the resources that they need and be able to do that. But it's all just time, and we need the test now. And so right now, where the tests are is kind of the bigger question. Why don't we have the tests? Well, these folks have the tests. I know there were some issues with bids where the federal government and the state governments were both bidding on the same batches, both of PPE and testing materials. Making new tests. I'm really.
All right. Can everybody hear me since Mayor Wojtowski? Yeah. Oh. I'm not a lip reader, so one of the things that I've heard from medical providers in the community is that because their criteria are so strict for testing, they have been doing instead, here are the symptoms of coronavirus, of COVID-19, and you have them. and here's the test for influenza and you don't have it, and here's the test for CSV, which is another virus, and you don't have it. Therefore, we're going to call you essentially a provisional test positive for coronavirus without a test. And the standard of care for that is to go home and self-quarantine for 14 days, essentially, and to monitor and to stay in touch with your medical provider. So it's not a satisfying answer for a lot of people, but that's what I understand a lot of medical providers are doing. Sheriff.
I'll unmute myself. So this morning I was on a phone call also with Oregon Health Authority, because one of the conversations has been around first responders. And the way that they explained it to me, which it makes perfect sense, is that a lot of people are under the impression that if they're around someone that they think may have received or may possibly be infected by COVID-19, but they're not exhibiting any symptoms at all, whether they're not coughing or they don't have a fever, the test is going to come back negative, because they're kind of in that incubation stage, and the virus is just sitting in their system, but there's not enough to actually, so they get a false negative. And so what's happening is they're waiting until those symptoms actually show up. And then because 80% or more individuals will have this and can self-quarantine at home and get through it just fine, they're waiting to test those people who are the high risk. And so, like you said, Commissioner Kula, they're sending people home, and from a law enforcement perspective, a lot of police officers and first responders are like, oh, I think we were infected and we want to get tested. But what the medical field is saying, well, if you're not showing any symptoms, the test isn't going to tell us anything. And I think the general public feels that it's this magic test is going to tell them if they've had any contact. But until you are showing actual symptoms, they aren't going to be able to test you.
That's a really good perspective. Thank you. One of the things that I thought I might try, Mayor Wojtowski, were you? No. Okay. I just want to reiterate that the executive order, I've had a lot of questions from people about, do I need a permit to travel? What about if I'm getting on the bus? And exactly, Sheriff says that too, and that's a no. And then I get a lot of questions from people about what businesses are open. Can my business stay open? And I try to answer first by saying, well, the executive order says stay home, but I understand as a farmer, I still have to have my business going. So how to do that in a world where you have a mandate to stay home is very challenging. But the executive order lays out for people that if you can't work remotely, you need to develop a plan that keeps all of your employees and all of your customers at least 6 feet apart all the time. And that's the basic place to start. So landscapers ask me, can I still have my landscaping company if I stay 6 feet away? And then there's a question of where do I go to the bathroom? And there's a lot of details in there that you as a business owner need to figure out. And I believe it was the sheriff who mentioned that there is guidance for that, but there's also a resource for employees who are concerned that their business isn't following the standards that have been laid out in the executive order. So the message still remains that we need to stay home as much as like physically possible right now. Any other thoughts before we turn this big old file over? Okay, thank you very much to all of you, mayors, superintendents, counselors, sheriff, and I just want to say stay safe, and I really appreciate working with all of you. Thank you for taking over this responsibility.
Thank you, Commissioner. And Mayor Wojtowski.
All right, see you later.